The coccyx, or tailbone, is the last vertebra of the spine and is susceptible to injury because of its position within the pelvis. If injured, the coccyx can cause more than just pain. It can cause weakness and a serious loss of motion in the back, hips, and legs, a condition called the sacral coccygeal or SC syndrome. Fortunately, there is a treatment called the Kemper-Woolley procedure that can help. You can see in this close-up that a normal coccyx will freely extend and flex, enabling pelvic floor muscles, tendons, and ligaments to distend and compress with sitting, standing, lifting, bending, and of course during defecation, sex, even when breathing, coughing, sneezing, and particularly while delivering a baby. Injury to the coccyx impairs these functions to various degrees and can irritate and weaken the nerves and muscles within the pelvis. This sacrococcygeal or SC syndrome is now known to potentially affect a large number of patients who believe that their coccyx injury had healed or was only responsible for some pain while sitting, not realizing that several chronic symptoms were actually related to and the result of a loss of coccygeal function. Your doctor is knowledgeable in this condition and understands what you've been through and can provide you with an effective treatment now available to help free you from the grip of Coccydynia and the many types of symptoms that may be robbing you of the flexibility and vitality you once knew. While research continues to unveil the complex inner workings of the human body, this artist's conception of coccyx function simply depicts a growing hypothesis and consensus that coccyx injuries may do more than just leave you with a bruised bottom. Fortunately, the Kemper-Woolley procedure can reverse much of the chronic pain and stiffness associated with Coccydynia and the syndrome. While results vary, more than 5,000 patients have experienced measurable and long-lasting improvement in their ability to move freely at home, at work, and while exercising. Your doctor will perform some simple tests to determine if you are suffering from the sacrococcygeal syndrome. An X-ray, brief physical examination, and questionnaire will determine if you are a candidate for the Kemper-Woolley procedure. First, in this cutaway or side view, you will see the 5 lumbar vertebrae, the sacrum, and the coccyx. Next, you can see the spinal cord as it descends down from the brain through the spinal canal. It is at this point where the spinal cord narrows into a filament, or phylum, which continues downward towards the coccyx. It then joins the important protective covering of the spinal cord known as the meninges or dura. Once the spinal cord, filament, and dura join together, they continue down and exit the spinal canal, anchoring to the coccyx. This is where the sacrococcygeal syndrome begins after a bad fall and where it is relieved with the Kemper-Woolley procedure. The coccyx has many functions. Perhaps most important is the protection provided to the delicate spinal cord and dura by this spring-like or shock-absorbing-like motion. You can also see how, with a functioning coccyx, doctors and researchers believe the cord and meninges may freely tether up and down while remaining protected in the center of the canal. While more research is needed to assess just how the coccyx possibly serves these and other spinal functions, it is clear that loss of coccygeal motion is strongly linked to serious pain, impairment, loss of spine flexibility, and strength. In this sequence, you can see how landing too hard on the buttocks can bend, displace, angulate, dislocate, or even fracture the coccyx, such that it creates a painful and often disabling downward and backward tension on the spinal cord that can feel much like a pinched nerve or worse.
If you believe you may be suffering from the condition, discuss your symptoms with your doctor. Your doctor will determine if the Kemper-Woolley procedure is right for you. Your doctor is skilled in the Kemper-Woolley procedure, which is specifically designed to ease the tension off your spine and nerves as much as possible. No incisions are required, and there is no downtime, with most patients resuming their exercise and daily routines the same or next day. And the procedure can be provided with comfortable local or general sedation as your doctor deems necessary. Procedures are performed on an outpatient basis and often result in immediate improvement. Although with many people injured long ago during childhood and not diagnosed until well into adulthood, long-lost spinal range of motion can return more gradually. As you continue to improve, exercises and stretching become easier. Strength is noticeably greater, and you begin to experience what many have called a rejuvenated degree of flexibility and vitality as the grip of the sacrococcygeal syndrome is progressively released. Whether you need 1, 2, or several procedures, as your coccygeal function improves, so does bending, walking, exercising, sexual comfort. Even improved elimination is routinely reported by happy patients who feel better and become more active when freed from the grip of the sacrococcygeal syndrome. This has been a Kemper Tailbone Injury Foundation production.